A stroke is a medical emergency that requires immediate treatment, but could you spot a stroke if you needed to? I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. Thank you for joining us for Be Well with Blessing. May is National Stroke Awareness Month. I'm joined today by Emergency Department Medical Director Dr. Scott Huff. Dr. Huff, thank you for joining me. Can you take a minute to introduce yourself?
Hello, and good afternoon or evening or morning for that matter. Once again, Scott Huff. I'm an emergency department medical director. I've been here at Blessing Hospital now close to 8 years and in the medical director role for the last 2 years. My
Well,
pleasure to be with you today.
I appreciate it. And again, we're talking about stroke. So let's start with some basic information. What is a stroke?
Well, a stroke can be two different things. What people mostly know a stroke as is a clot in the vessel of the brain, and this leads to a deficit of either speech or weakness somewhere in the body. But the other type of less commonly known stroke is the actual bleeding stroke, and that's from a rupture of, let's say, an aneurysm in the brain. They both can present similar, but definitely two different causes of the deficits that the patient could be experiencing.
Okay, so good information there on what causes a stroke, what is a stroke. And there are warning signs, and you kind of talked about deficits, these signs and symptoms of a stroke. What should people be aware of?
Well, we actually use the acronym FAST, and FAST stands for four different things. The F in FAST stands for facial weakness, and this is, basically somebody having weakness in any part of their face. The second would be arm weakness, and that's the similar thing. It's weakness in an extremity, either the arms or the legs, and it's usually unilateral, or it could be right arm and left leg. The next would be S, which is speech difficulty. That if the patient has a difficult time getting their words out or just looks at you funny when you're asking them a question but doesn't answer, that could be a speech difficulty, which could be a sign of a stroke. And then lastly, the T of the acronym, that's time to call 911. Anytime a patient is having any of these signs, facial weakness, arm weakness, speech difficulty, we want you to call 911 immediately.
And now you kind of alluded to these symptoms might not be as obvious as people expect them to be. They might be more subtle and they could even involve vision and balance. Can you talk about a little bit more about those symptoms, things that people might not be as aware of?
Yeah, definitely. If you have a sudden vision loss, this could be an isolated stroke that's just affecting that one eye. So definitely that could be a sign of a stroke because it could be the vessel of the brain that actually affects eyesight. The second would be just sudden uncoordination or sudden inability to walk, or you could have a constant spinning sensation type dizziness. These are evidence or these are signs of a posterior stroke or back of the brain stroke. So definitely equally as important as facial weakness, arm weakness, and the speech difficulty as we talked about.
So people might be experiencing one or maybe all of these symptoms, but regardless, they need to have them checked out because it could be signs of a very serious medical condition.
Definitely.
Now, is there anything that I or anyone else can do to reduce the chances of having a stroke?
Yeah, I mean, there's modifiable and then there's non-modifiable risk factors for stroke. So the modifiable risk factors for stroke are such things as blood pressure. High blood pressure is a very modifiable thing. Additionally to that, there's smoking. Smoking is a modifiable risk factor. If people were to stop smoking, it puts you at less risk of having a transient ischemic attack or a stroke. Next would be diabetes, type 1 or type 2 diabetes. That's definitely something that could be modifiable because you can control that as well. Additionally, diet is another form of modifiable risk factor. You want to stay away from high saturated fats, trans fats, or any kind of foods that are high in cholesterol, because these are well known to raise blood cholesterol levels, which could lead to a higher risk of stroke. On top of that, salt in your diet, increased salt intake is also a modifiable risk factor. We know how much salt we can take in if you just pay attention to the foods that we eat. So those are all of the main modifiable risk factors on top of physical inactivity. That's something that we can we aim to be inactive at least 150 minutes a day is what's the recommendation, which would also lead to less obesity because that's another modifiable risk factor. As far as the non-modifiable risk factors, these are things that you're either born with or part of your genetics. So age is a thing that is not on your side when it comes to a stroke. The older you are, obviously you're at higher risk. Family history is a big non-modifiable risk factor because you're once again born with the genes that you have, and
Mhm.
if your family is at risk for stroke or has shown stroke at a young age, that puts you at higher risk as well. Race is actually a well-known non-modifiable risk factor. The African American population has a higher risk from stroke than Caucasians do. Uh, Women, it's another thing, gender. So women are at higher risk of having stroke than men. So those are the majority of things that are modifiable and non-modifiable risk factors for stroke.
So I think the key would be if you maybe fall into one of those categories where you're at higher risk because of a non-modifiable risk factor. It's really important to pay more attention to those things that you can control, like your diet and your lifestyle choices.
Oh, absolutely. That's why we stress the importance of making sure your blood pressure is under control and that you take appropriate medications to do such, either for high blood pressure or diabetes. And then obviously, better diet and encouraging activity amongst individuals.
Great, really good information there. Now, if somebody begins to experience symptoms of a stroke, or maybe they're with someone who they think might be having a stroke, what should they do?
Well, first things first, yeah, recognition is the key. So if you recognize it, it is very important to get to that to the emergency department as quickly as you can for further evaluation and treatment. I mean, the old saying, "Time is tissue" or "time is brain" is kind of what we utilize to determine the ability to reverse the stroke or actually do something to prevent further deficits. So if somebody notices any of those things, as we mentioned, part of the FAST acronym or the dizziness or weakness, once again, or sudden vision loss, we want you to call 911. Definitely, the sooner the patient is assessed, both by EMS and in addition to the emergency department, the quicker things can be done to reverse it. So the important things to note are, the onset of these symptoms or the last time the patient was known well without the symptoms. That's a key factor in determining if they're a candidate to have anything done. You have up to 4.5 hours to intervene with a medication that's a clot buster medication if it's a ischemic stroke. And you have actually a great deal of time after that to retrieve it if there's a clot that a specialist could intervene on. But the sooner you do that, the better. But you have certain time criteria for both of those matters.
So, time is a factor. So, if you think somebody is experiencing symptoms of the stroke, note the time, call 911. Definitely not a situation where you should be driving yourself or having somebody drive you because it is a medical emergency. And our partners
Exactly.
in EMS do a wonderful job of notifying the hospital so you guys know that this person is coming in and you can intervene right away.
Yes, we have a great system. I mean, we get along very well with our EMS colleagues, and they fall under our department as well as far as leadership. So we have actually, they're on the same page when it comes to a patient presenting with any of these symptoms. As soon as they see the patient, they obtain the same information. The last time known well, they do a brief neurological exam, and they call ahead. So our team is ready for this patient before they even get there. So it is an integral part of the treatment and timeliness of treatment of the patient.
And now we've touched on this a little bit, but statistics show that stroke is the leading cause of long term disability in the US.
Mhm.
Um, but timely treatment, as you have said, can increase a person's chance of recovery. So, kind of walk us through what happens once a person calls 911 and they get to the hospital. How do you diagnose and decide on treatment for that individual?
So, yeah, calling 911 is going to activate the ambulance to the location where the patient is. Obviously, immediate assessment is occurs on the scene, and then it's called ahead to the emergency department. Depending on the time frame, 5, 10, 15 minutes, they'll let us know the onset of when the patient will arrive. Once they do arrive, they go directly to the CAT scanner and get a quick CAT scan of their brain, in addition to a rapid assessment by the ED physician who is meeting that patient on presentation and walking over to the CAT scanner with the patient. We're doing a brief assessment to determine how bad their deficits are. They subsequently get their CAT scan of their head. They come back to the emergency department treatment area where we do a further evaluation. And we do actually have a partner with a teleneurology service who helps determine the deficits and helps determine whether the patient can get treatment with the blood clot busting medicine called TPA, or if they're a candidate for retrieval of the clot, in which we have a partnership with Springfield St. John's Hospital, where we will rapidly get the patient to that facility for intervention if that's the need.
So again, recovery is possible, but timely treatment is the key. So first steps, as you said, is recognizing. Second step is calling 911 and getting to the hospital. Is there anything else that you would like to add to the conversation today? Things that people should be aware of with stroke, or what you would want people to know if their loved one had a stroke? Anything that you want to add?
I think the biggest thing, once again, with any kind of educational piece for the medical field, and when it comes to stroke particularly, is that time of onset of the symptoms. I cannot stress the importance of the patient getting to the hospital as quickly as they can when they're having any of those signs. So I think that's the most important thing. I mean, in the early beginning of taking care of heart attacks, it was the same way, and we've gotten to the point where we manage heart attacks just like clockwork, and we're getting there with stroke treatment globally. It's just going to take a little time to get there. And I think education to the public is the most important piece to that. And that is early recognition and getting to the hospital as quickly as possible.
Well, thank you so much for joining us today. And for more information on stroke and Blessing's nationally recognized stroke treatment, you can go to our website, blessinghealth.org/stroke. Again, Dr. Huff, thank you for joining us.
My pleasure. Thank you.
Thank you.